The restrictions announced by the President Cyril Ramaphosa on Sunday helping ease the pressure on the province's hospitals. Well, to help us answer that, I'm joined now by Gauteng Premier's Advisory Committee Chair, Specialist Dr. Mary Kawonga. A very good evening to you, Dr. Kawonga, and thank you so much for your time. I know it's only been about 4 days since the President announced those restrictions, especially clamping more down on Gauteng as the epicenter of the country. Have those restrictions helped in any way?
Good evening, Morena, and thanks for having me on your show. I think, as you said in your intro, it's way too soon for us to tell whether the restrictions are having any impact. It's usually takes a bit of time, maybe up to even 2 weeks, before we can even start seeing the impacts of lockdown measures like this, the one that the President announced earlier this week. I think it's only been a few days. And so the cases we're seeing, so for example, the cases we saw today with close to 13,000, those infections were acquired before the lockdown restrictions were imposed. And so it's unlikely that we would see a sudden drop in cases, hospitalizations, deaths, etc. It's way too soon to tell. And so the hospitals continue being under pressure. And I think this is what we had actually indicated when we did our last media briefing. The hospitals will continue being under pressure even after the lockdown restrictions are imposed, until possibly the peak, which is predicted to happen in the next few days, the first week of July. But perhaps what we might see is, if the lockdown measures work and people continue to adhere to the restrictions, that we might start seeing an easing off on the hospital occupancy, perhaps 2-3 weeks after the peak.
Doctor, how bad a situation can we expect if you're saying that the peak is only but to come?
Well, I wish I knew for sure, but you know, based on the modelling predictions that were done by Prof. Milado, who's a member of our committee, we expect the numbers to continue increasing, but perhaps the rate of increase will start slowing down until we get to the peak sometime this week, is what was predicted. And then after that, perhaps the numbers will start going down. That was what was predicted, and we're looking to see what happens. But it doesn't mean we should all sit back and say it's inevitable. We still need to adhere to the restrictions, because the fewer infections we can get, the fewer hospitalizations there will be, and therefore less pressure on the hospital system.
We're obviously hoping that these numbers start dropping, perhaps sometime next week, maybe even the week after. And I would imagine we're expecting the President to address us once again after 2 weeks, when he did say that that's as long as the restrictions will be in place for. Would it be advisable for the President to lift these restrictions that he's imposed, especially on Gauteng, or to keep them as they are beyond the 2 weeks that he's got them in for?
I mean, I think often, when decisions are being taken about whether or not to ease lockdown measures or public health and social measures, as they're referred to, you have to look at the epidemiological situation. You have to look at the extent to which we think the pandemic has come under control, and whether the level of community transmission is reduced to a level where we feel safe enough to open up. And I think that's what will determine whether or not to continue with the restrictions. They're those very important health and epidemiological considerations. Because if we lift them too early, then there's the possibility of a resurgence occurring again. And I know it's obviously balanced against economic considerations, but the health considerations are also important. And I'm glad it's not me making the decision, that's all I can say. But there's some principles that need to be adhered to when making those decisions. I'm hoping they will be adhered to.
Dr. how severe is the situation in this province? And I know you mentioned that there is pressure, obviously, on the facilities that are in Gauteng. And there was also a bigger concern as well that was raised about how, not having Charlotte Mackay operating at full capacity is one of the problems that, was raised and that came up with Gauteng struggling, especially the facilities. So how severe is the issue where facilities are concerned in this province?
Look, I mean, the facilities have been under pressure. I think there's been a lot reported in the media, and the Department of Health has also reported the pressure that the facilities have been under. I think the there wasn't any expectation at all that, because of the lockdown, there will be an easing of that pressure. The pressure continues. I think if you look at the data that's been reported about new hospitalizations, the number of new hospitalizations in Gauteng have been in the last week about 600 or so on average per day, which is extremely high number of new admissions. And so that itself tells us that the hospitals are under pressure. And as I mentioned earlier, for the hospitals to recover, there's a need for, I think, some restrictions to continue to ensure that we stop the generation of new cases. And I think that will be an important consideration when the President is thinking about whether or not to lift or continue with the alert level 4, adjusted alert level 4.
Dr. Kawonga, we'll leave it there for now. Thank you very much for your time here on Newsnight. That is Dr. Mary Kawonga, of course, the Gauteng Premier's Advisory Committee Chair and, of course, medical doctor and public health specialist.